Earlier today, experts from around the region, including New Zealand, South Korea and Indonesia, gathered remotely for a webinar to discuss border control.
Organised by the NUS Swee Hock School of Public Health, panelists engaged in a wide-ranging discussion on how each country is dealing with the prospect of reopening. And moderating the panel was the school's dean, Professor Teo Yik Ying.
Well, Professor Teo is still with us. So, Prof, what were your main takeaways from the discussions with your regional colleagues?
I think there were three main takeaways actually. The first was really around how right now different countries have different approaches in terms of reopening their borders or even relying on flight restrictions, on quarantine, be it at home or at government facilities, using impact on health insurance or even the use of testing, different types of tests to manage people coming into the country. And I think one of the key takeaways is really around the need to harmonize some of this procedure so there is greater clarity and certainty for anyone looking to travel in different parts of the world. So, and the next is countries do need to take a more nuanced approach towards implementing some of these border control measures. A 14-day quarantine, it's a very safe approach, but may not be realistically required for some of the countries and territories that have the community situation very well under control, such as New Zealand, such as many parts of Australia, Hong Kong, Vietnam, Thailand. These are places where their situation is very well controlled. There is no requirement of a definitive 14 days quarantine. And the third is really around how can we make use of testing, whether it is antigen rapid test, whether it is the PCR test, or in Singapore, we have this new test on using breath analyzing to facilitate the reopening of borders that manages both to do so safely and yet allow people to come into the country requiring as little amount of quarantine as possible. Remember, safety is always paramount in all of these discussions.
Right. Prof, one of the big challenges in resuming air travel is coming up with a coherent policy that all parties can agree on. What did the panel have to say about that?
This was something that we did touch on as well, and it's certainly an aspect that there is a need for a global framework that to be established around recognizing who are the people that can be allowed to travel in a more unrestricted manner. Clearly, we have heard all these discussions around vaccine, and the WHO, the World Health Organization, has a COVAX facility that is looking at the equitable distribution of approved vaccines. The question now is not just on the distribution and the uptake of this vaccine. The question is, when people like myself, if I have received the vaccination, what certification is there to accompany this vaccination that allows me to move about in the world in a way that countries firstly recognize and respect this vaccine that I have received and allows me to enter the country in an unrestricted manner. So this requires a global framework to be established really to address and recognize, is there going to be a COVID-19 vaccination certificate or passport? Very much like what we currently have for yellow fever. There's a yellow fever booklet or certificate that you need to bring with you if you're traveling into any country that has that is endemic for yellow fever.
Well, Professor, let's move on. Singapore Airlines will start 3 weekly non-stop flights to New York's JFK International Airport in November, which will transport both passengers and cargo. But leisure travel to the US is virtually impossible, even discouraged at this point. So what is the significance of this announcement, you think?
Well, we will have to see what is the impact on travelers, because I believe there is a demand for travel, even to the United States, that perhaps will be addressed by having this flight made available, and now you can fly over to New York. But I think more important than that is really a signaling to the world, to IATA, the International Air Transportation Association, that Singapore is open for business. We are keen to really consider what are the precautions that need to be put in place to allow travel to resume in a safe manner. And this signaling immediately sends the right message that we are opening up a route to New York. And of course, we will manage the risk that comes with it appropriately. And yesterday's announcement, one of the important announcements was that in the past, if I travel to a country which doesn't have a bubble arrangement or a green lane arrangement, I have to forfeit my right to claim subsidized medical care. And that has now been lifted and made permissible. Meaning, even if I do travel to the US, and in the event that I do get infected, at least I have the reassurance that Singapore will continue to take care of me when I come back in a subsidized care manner. And I think that makes a big difference.
Right. Well, thank you so much for your time today, Prof. Teo. We've been speaking to Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS.